A prominent systolic murmur coexisting with severe cyanosis is in favor of double outlet right ventricle than tetralogy of Fallot. Prominent left parasternal heave is also more likely in DORV. DORV VSD PS is a condition with tetralogy of Fallot-like physiology, that is, cyanotic congenital heart disease with low pulmonary blood flow. VSD, ventricular septal defect. PS, pulmonary stenosis. In DORV, the shunt across the VSD is called an obligatory shunt. This is because left ventricle has no outlet other than the VSD. In DORV, both pulmonary artery and aorta are arising from the right ventricle. So blood reaching the left ventricle from the left atrium can go out only into the right ventricle across the ventricular septal defect. In DORV, right ventricle ejects both into the aorta and the pulmonary artery. Pulmonary blood flow will be limited by the severity of pulmonary stenosis. If pulmonary stenosis is severe, more blood will flow into the aorta than the pulmonary artery. Since the whole left ventricular output flows across the VSD in DORV, a significant murmur is audible. In TOF, as the pulmonary stenosis is severe, blood flow from the left ventricle will preferentially flow into the aorta than into the VSD. Large VSD in TOF does not produce any murmur because there is no pressure gradient across it. In TOF with severe PS, the flow into the pulmonary artery is low so that it will not produce a loud murmur. But cyanosis will be severe in TOF with severe PS because most of the right ventricular output goes into the overriding aorta. Though ventricular septal defect and obligatory left to right shunt has been mentioned to be mandatory for survival in DORV, a rare case with intact ventricular septum has been described by Subramaniam A. and associates. In their case, there was an unguarded left atrioventricular valve which was represented only by a ridge of tissue on the lateral aspect of the left atrioventricular groove. There was free mitral regurgitation, large fossa ovalis atrial septal defect, and left to right shunt. Both pulmonary artery and aorta were arising from the right ventricle. Here is a journal reference for DORV without VSD.